On behalf of the Children and Families Across Borders and the Global Social Service Workforce Alliance, I welcome you to our event, The Social Service Workforce in and Beyond the Pandemic, a global conversation on adaptation, innovation, and the fight for social justice. My name is Kathryn Wehrmann, and I am the current Global Social Service Workforce Alliance Steering Committee Chair and will serve as your moderator for today's event. We and all we serve and all who we serve have been profoundly affected by the pandemic and all it has made us aware of regarding our strengths and limitations and our ability to adapt and innovate. Our hope for this event is that we share, each of us, wholeheartedly and validate our collective efforts and experiences in our past and ongoing efforts to navigate these challenging times. To ensure that as many people as possible can fully participate, we have French and Spanish translation available in our main meeting room for this event. If you would like to use this option, select the language you would like to listen to at the bottom of your Zoom screen as shown on the slide. Just a note here, we do have a French interpreter who will be joining us shortly, and you'll be notified if that is a language that you would like to hear the proceedings in. As you can see, for today's event, as a unique opportunity for social service practitioners, experts, and policymakers from around the world to have a critical discussion. And you can see from our chart that 611 people from 995 different countries have registered. The pie chart here shows where the largest percentages are from, but we have quite a wide variety from all over the world, including Yemen, Japan, Somalia, New Zealand, and more. Let's have a look at our Slido poll. Let me see here. I'm taking a look at mine to see if we have any results yet, and I'm not seeing them, but we'll return to it and see where everyone is from. If you scroll all the way to the bottom, you should be able to see how the poll populates in terms of what types of positions people hold that are joining in today. I'd like to introduce you to our host organizations. The first is the Global Social Service Workforce Alliance. It's an organization committed to building a social service workforce through serving as a convener for an inclusive and representative network of stakeholders. GSSWA supports the stakeholders in advancing evidence-based knowledge and advocating for workforce supportive policy reform. Currently, there are 3,000 members from 145 countries who work at a variety of levels and organizations. At present, a primary funder for the Alliance includes the U.S. Agency for International Development and the United Nations Children's Fund. Children and Families Across Borders, also known as CFAB, seeks to bridge the gap between local child protection teams and international regulations and bring cross-border and cross-cultural emerging issues to light to inform best practice. It is the only UK charity with an international children's social work team and the only UK member of the International Social Service. CFAB works with partners in 130 countries, providing social work expertise in cross-border child protection cases and overseas placements. In addition to offering a wide range of case management services, CFAB has a free advice line staffed by their social service professionals ready to provide guidance and practical support on international child protection issues. CFAB delivers specialized international social work training and offers a wide range of free resources for social workers on their website. So please do have a visit to the site for more information. In today's program, as you can see from the agenda, we'll be looking at the impact of pandemic in the areas of practice, education, and training, considering both risks and challenges, as well as the opportunity for innovations and adaptations that may be a part of the future. We will be considering the ways that the social service workforce has and can continue to work on overcoming wide-ranging social injustices that have been intensified and made much more obvious to the world as a result of the pandemic. It is our hope that using technology as a tool and our collective investment in enhancing our efforts, that we will make this a highly interactive event. As you can see from the agenda, both in your packet and on screen, we are going to first hear about the State of Social Service Workforce Report. Following this presentation, we'll move into the first of 3 sessions focused on the topics I just mentioned. Following a short break, we'll move into the final session on the role of the social service workforce in advancing social justice, followed by closing remarks. I would like to briefly review how we will use our 2 platforms, Zoom and Slido, as well as how our break rooms will work, or breakout rooms will work. Please use the Zoom chat function if you have technical issues that please send a direct message to tech support. Please stay muted and keep your video off when you are in the main meeting room. And just so that you are aware, the main sessions are being recorded and will be posted to both Global Social Service Workforce Alliance sites and CFAB site. For breakout rooms following each session, you'll automatically be assigned to a room. Should you need help while in a breakout room, you can request help and the host will be called. When you are in the breakout rooms, please be sure to unmute and turn on your cameras. For time's sake, please keep introductions limited to your name, organization, professional role, and country. And just so you know, facilitators will be moving among the rooms to listen in on discussions. We'll also have language-specific rooms to accommodate our French or Spanish speakers. And if you would like to be in a language-specific breakout room, follow the directions on the slide here, click on breakout rooms in your Zoom meeting controls and hover your pointer over the number to the right of the breakout room titled Español or Francés and click Join. Slido will be used for interactive discussion. As mentioned earlier, to access Slido, open slido.com in your browser and type in the code #globalconversation. Throughout and after each breakout discussion, please provide your reflections via the Ideas tab and keep in mind that you can reply and like other participants' reflections and comments. Once again, the discussion questions for each breakout can be found on the Ideas tab in Slido. And I need to correct and say, try to put your reflections in towards the end of the breakout room discussions. Finally, we would love it if you would help expand the conversation and awareness of our event today by tweeting about it. So please do that. Thank you. I'm going to leave the slides and stop sharing my screen here. And at this point, we are going to welcome our first presenter, who will be discussing the state of the social service workforce report with us. Hugh Salmon, the director of the Social Service Workforce Alliance, will be starting us off with this overview of the Alliance's 2020 Social Service Workforce Report. Hugh joined the Alliance in August of 2020, is a qualified social worker with 10 years of experience in direct social work practice and management of social services, and 20 years of experience internationally as a technical advisor, trainer, consultant, and program manager. Hugh was a member of the leadership team that established Family for Every Child as a new global alliance of local civil society organizations committed to reforming and improving children's care worldwide. During this time, he helped grow the membership and strengthen the engagement of members in the overall network. He also coordinated a range of multi-country members project for research, learning, and practice exchange, and led the development of the RISE Learning Network on recovery and reintegration from child sexual exploitation. As Hugh provides his presentation, please submit any questions you have via the Ideas tab on Slido. At this point, I'd like to turn the conference over to Hugh Salmon.
Thank you very much, Kathy. It's great to be here. Welcome, everybody. It's good to see people from all over the world already. I can see 161 people joining us, which is wonderful. Before I start my presentation, I just thought I'd look at Slido. I don't know if you can do the same. There's an Ideas tab and a Polls tab. The Ideas tab is to discuss my presentation, but the Polls is showing that we have 46% involved directly in social service delivery. Which is great. So a large number of you are practitioners, are working on the front line, closely followed by people from the academic sector, then advocacy, policy, management, and so forth. So you can see the results of that if you go to Slido and click on polls. Okay, I'm just going to share my screen so we can just start my presentation. Okay, so today I'm going to be talking mainly about our report, the State of the Social Service Workforce Report for 2020. So the title of the report is Responding, Adapting and Innovating During COVID-19 and Beyond. As you can see from this slide, we've actually been producing these reports for a number of years now. The Alliance was founded in 2013, and then we started doing these reports from 2015 onwards. And they tend to be on different aspects of social service workforce strengthening. And you can find all of those on our website. This particular report explores the key challenges that the social service organizations and workers have faced since the beginning of the pandemic. And it showcases how they've been able to adapt and innovate in response to such challenges. It further explores the lasting impact of the pandemic on organizations and workers, and it looks at their challenging roles and the opportunities they now have to further innovate and raise awareness of their work. So it's very much about, when we say during COVID and beyond, it's about what we've learned now, but what is also going to last into the future. Of course, when we were deciding on a theme for 2020, COVID was obvious, and yet COVID is by no means over. So this is a challenging moment to compile a report that seeks to draw any kind of firm conclusions on the pandemic or the times that we're living through. The reality is that COVID-19 is an ongoing crisis, and this became apparent as the report was being developed. And it could be argued that it's too early to process the entirety of the crisis and its impact on the social service workforce. However, the report is intended to at least provide a global perspective on the varied, challenging, and often innovative ways that the social service workforce has reacted and adapted since this unprecedented crisis began. So we're very excited to be able to launch this report to you today during this annual event. And I'll be going over some key findings, but be sure to download it from our website, which is socialserviceworkforce.org. So this slide just gives you a sense of the methodology that we used. You know, we very much drew from a wide range of global reports and case studies that had been written about the pandemic and the impact on the workforce. But we also carried out surveys. So we had 2 surveys of our members. One was early on in the pandemic, between April and May of 2020, and another one March to April of this year. And those surveys explored the challenges that social service workers, managers, and supervisors were confronting throughout the pandemic and the methods they were using to adapt to such challenges. It also explored what they anticipated their future professional and organizational needs and priorities would be. So if any of you here today took part in the survey, we're very grateful for your help because your views have directly informed this report, which we're launching right now. The questionnaires were received from 219 respondents in the survey last year and 50 respondents this year. And they came from a wide range of different countries, as you can see. So this just represents some of the range that you can see. Particularly welcome that we had so many from Eastern and Southern Africa, which was the highest region represented, but also well represented were the regions of North America, South Asia, West and Central Africa, and then Europe and Central Asia. So it was great to have, you know, a really wide range of different regions well represented in the report. So in terms of what we tried to cover in the report, well, the initial focus was on the essential roles of the social service workforce during COVID-19. And as many of you are aware and probably experienced, it took some time for governments to recognize that the workforce does have an essential role to play. Initially, the focus was much more understandably on the health workforce. But over time, we have found that the workforce has performed the sort of roles that we normally see the workforce performing at different levels, which are in prevention, in response to issues as they arise and working on particular cases, and a promotive role where we very much talk about advocacy, raising the profile of the alliance, of the workforce and making sure it gets the resources that it needs. Additional roles included, of course, providing direct assistance and psychosocial support to individuals, families, and communities at large. And that included raising awareness on the pandemic, enabling access to services and advocating for the most marginalized and vulnerable in particular, who were most seriously affected by the pandemic owing to lack of information, lack of ability to access services, lack of access to technology, and a whole range of reasons why they were in great difficulty. And they were particularly affected, of course, by things like school closures, which also meant that supporting children and families was a big focus, and particularly around child protection, because there were a number of risks that children faced being at home with family when family were facing a lot of extra strains and pressures. There was also a focus on trying to build the resilience of individuals, families, and communities to get through the crisis. And then, of course, as I mentioned, providing public information about COVID, how to prevent and respond, and how to keep safe. So there were a number of challenges, though, during this time faced by the pandemic. In particular, there was the increased demands on the workforce in terms of an increased caseload and greater complexity of cases. There was also increased levels of occupational stress and burnout, and many of you here today may well have experienced that during the pandemic. There was in many cases insufficient number of staff to cover the increased demand, and that often led to either rapid recruitment of staff or more reliance on volunteers at community level. But that the problem then came that some of those were deployed without adequate training or supervision, and sometimes there was almost too much of a reliance on volunteers, which was placing them in risky situations. What we also found is that the demand outstripped the resources, even when sometimes funding was actually cut for the social service workforce. And as I've mentioned, in many cases, the workforce was not initially deemed essential, so it left many workers unprotected without PPE. But they still had to perform essential roles, and often that it did involve still visiting certain families and still doing some face-to-face work. Where the workforce was classified as essential, Then they were given new responsibilities as well as the required protection. And some of those responsibilities included raising community awareness and also things like contact tracing. Of course, what happened with many organizations is that they shifted to a remote form of delivery, but they did that with no prior experience or training. So that was a challenge in itself. It meant that for some, it hindered the effective work that they used to do, and it made it difficult to provide appropriate case management services. In some contexts, there was a lack of access to electricity, internet, and the devices to access this remote delivery. So it was very difficult for both workers and beneficiaries. It also seriously affected certain groups who lack ability or confidence using technological devices. So one particular quote here from Rwanda was just illustrating this fact, saying, well, nurses and doctors were given protecting materials immediately, but no one cared about social workers and community workers, and support to vulnerable families was not considered urgent. So that just reflects some of the early challenges that were faced. We then move on to answering the call. So how did the workforce then respond to these challenges? Well, they did a wide range of things. They were supporting continuous effective service provision for both workers and clients. That meant choosing communication channels based on the client's preference, so what was most convenient for them. It meant in many ways use of helpline, distributing actual devices such as tablets or phones or computers to help isolated people keep in contact online, and finding safe ways to meet in person when that was necessary. That might have meant meeting outdoors or in public spaces, but that raised additional dilemmas of how to keep that meeting confidential. There were some strategies to address those caseload concerns. They included task shifting and upskilling, staff hiring, so different ways of basically distributing the workload and trying to get more people to do that work. Examples include from Somalia, where UNICEF helped the deployment of recent social work graduates immediately into the workforce. And in other cases, I believe third-year students or final-year students were immediately placed in the workforce rather than doing their final placement. There were case studies for increased use of volunteers, also mentioned in our report. And we found that there was a wide range of collaboration with other organizations and community structures, some of which had not been previously taking place. There was definitely a big element of advocating for the workforce to raise recognition and support as essential. And so we found that, for example, in Iran, the Association of Social Workers advocated for government support and directly updating the president, and that gained them greater support in their work. The Philippine Association of Social Workers in the Philippines resulted in social workers becoming entitled to hazard pay for working during the pandemic. The South African Council for Social Service Prevention, Social Service Professions advocated successfully to government to ensure that the workforce was considered essential. And in Uganda, there were successful advocacy efforts in the early days, which resulted in reopening of the National Child Helpline and recognition of the workforce again as essential, and also making sure that they had access to vaccines when they became available. So you can see that advocacy was a very big part of what the workforce needed to do, particularly through professional associations during the pandemic. There was also a big focus on supporting workers' health and well-being. And the ways to do that included virtual training and learning events, a bit like this one. There was a very wide range of those, but also very different ways of making sure that team members kept in touch with each other, that managers kept in touch with their teams, using different means, both formal and informal, building team morale and helping people feel motivated and coping with their stress. There was also other self-care techniques which workers used, such as making sure to have a work-life balance, different types of rest, recreation, prayer, and meditation. And some organizations provided financial support or other compensation for the increased level of work. There was also that personal protective equipment, and the media began to recognize the work of the frontline staff. All of that helped to protect and support the workforce. An example from Portugal there of how they innovated by setting up helplines and also doing some shopping for isolated older people. So looking ahead, this is really where I think we will do this during our discussion. We really want to see what will be the lasting impact of the pandemic on the social service workforce. We understand that technology is clearly going to have a huge part of our work going forward. We've all used applications that we didn't use before. So there will be increased use of online platforms and technology in both service provision and case management, but also things like conferences like this one, and supervision and training, but also family conferences and working with groups of people as part of our casework. There will be enhanced cross-sectoral collaboration around social service delivery, and there will be continued flexibility and readiness to adapt. So that's all some of the positive side that we anticipate, and we're great to have your views on that too. In terms of the future role of social service organizations, we very much envisage there to be a strengthening of social protection and making sure that social protection, including cash transfers, is better linked and integrated with the social services that the social service workforce provides. We also hope that worker needs will be better identified and supported in future, and there will be that advocacy in future pandemics or similar humanitarian situations. So the future workforce needs will include training, capacity building, resources and coordination, and above all, greater recognition and support among leaders. So just a quote there from South Africa about the trauma and stress of the workforce being largely ignored. So in future, we really need a risk management strategy. So the recommendations, I won't go into these in detail, you have them in the report, but it's essentially around those things I was talking about making sure the workforce is safe, supported, funded, resourced, has the right infrastructure and technology, and then organizations can develop guidelines, better cross-sectoral collaboration, and make sure that we are ready for future emergencies, because we're very much conscious that even as the pandemic subsides, we have to face climate change and the very varied impacts of climate change and other crises that will occur in countries or across regions. And increasingly, the workforce needs to be ready to respond. So there's our report once more. I hope you will enjoy it and access it. That's it from me. And we will now be going into the breakout rooms, I believe. Over to you, Kathy, to help with this part. Thank you very much.
Well, we might have time for you to have a look at one question, Hugh. We have a couple of minutes, and I'm assuming that we can follow up on some of these questions on our website as a part of the continuing education. So if you would like to choose one.
Yeah, okay, just give me a moment to read them, because I've just been looking at my slides, obviously, and hopefully other people will be writing them in. So some of them are comments, which are great, and hopefully you can respond to each other's comments. So one question, did any of these findings lead agencies to change procedures or policies that could remain in effect for better service or more equitable service post-pandemic? Well, it would be interesting to hear from yourselves. I think that there have been some changes in procedures. I think that people are more aware of, particularly when shifting provision to reliance on technology, then that access has to be equitable, because it could advantage some people and disadvantage others. So I do believe that some of those changes are happening, but certainly I think that unfortunately what happens in a crisis is that you tend to get immediate changes in practice before they get necessarily reflected in policies or regulations. But we've certainly seen a very wide range of guidance issued globally on how to adapt during the pandemic. And some of those are also summarized in our report. Okay, I'll just see. So I'm just, so some of them are additional comments. There's one couple of comments in Spanish about how do you secure commitment from governments for the protection of the social service workforce in these challenging times. I think that, I mean, I've just described some of the different ways, but I think that the most important thing is that the social service workforce needs to come together as an organized group. And when I didn't mention, but the definition that we use as described in the report for the social service workforce includes a range of workers. So professional social workers, but also parasocial workers, child and youth care workers, community level workers and community level volunteers, and various different roles and titles such as social welfare officer and childcare officer and so forth. So we have a very broad coalition of workers anyway. In some countries there is a professional association, but often there also needs to be informal coalitions that come together to advocate together to governments. And then also it's about finding additional allies outside So often collaboration with the health and education sector has been important, but there have been donors and partners who've also helped with that. So I'm just seeing any other questions are coming up in Slido.
And we're pretty close to time on this.
Yeah, okay.
So what I would encourage you to respond to one another's, and we can call out some of the questions to respond to on our website. So thank you, participants, for your interaction. This is what we want to see. And thank you, Hugh, for a great presentation on the report.